You're here because you want to get smart, fast, right, to really understand what matters without getting bogged down. Okay, so today we're taking a deep dive into something that could be affecting your furry family member, maybe without you even knowing it. Aflatoxin mycotoxicosis. Sounds complex, I know.
Yeah, it's a bit of a mouthful.
It is, but we'll break it down. We're talking about a sneaky danger, toxic stuff made by molds.
That's right, molds that can contaminate everyday pet food.
And there are a few types, B1, B2, G1, G2. But the main one we worry about is B1.
B1 is the real troublemaker, yeah. It's the most common one found and unfortunately the most toxic.
Got it. So our goal today, our mission, is to really understand the risks here, figure out the warning signs, and empower you with what you need to know to protect your pets.
Absolutely. And it's interesting, you might not hear about aflatoxin in dogs constantly, but it definitely pops up, usually in outbreaks linked directly to contaminated pet food patches.
Okay, so like multiple pets getting sick from the same food source.
Exactly. And for cats, it's mostly been studied experimentally, not seen as much in sort of real-world outbreaks. But there is some evidence suggesting, that younger male pets and also pregnant females might be more vulnerable.
Okay, so specific groups to be maybe extra mindful of.
Potentially, yes. So while it might seem rare day to day, the potential for a significant issue if contamination occurs, it's definitely there.
Okay, so let's get practical. What might you actually see if your dog or cat has been exposed? How would you know?
Well, the signs can show up quite quickly. We call that acute onset.
Acute. How quick is quick?
Usually within about 3 weeks of them eating the contaminated food.
Wow, okay. And what are those signs?
You might see a sudden loss of appetite, just refusing food, vomiting, diarrhea.
The usual suspects for something being wrong then.
Yes, but then you might see more worrying signs, like a yellow tinge to their skin or the whites of their eyes. That's jaundice or icterus.
Yellowing? That sounds serious.
It is, and it can lead to problems with their blood clotting coagulopathy is the term, which can then result in bleeding, particularly like gastrointestinal bleeding.
Oof. Okay, so that rapid development, that's a key thing to watch for.
Definitely. But it's not always rapid.
Ah, right. You mentioned earlier, it can be slower.
Exactly. Exposure can happen more gradually, maybe lower doses over time, leading to what we call a chronic onset.
Chronic. So what does that look like?
Over a longer period, you might notice a more sort of subtle decline in appetite, maybe ongoing intermittent vomiting and diarrhea. And eventually, unfortunately, signs that the liver is starting to fail.
Liver failure. And you mentioned something about fluid buildup.
Yes, another concerning sign of this chronic exposure can be fluid building up in their abdomen. The belly might look swollen. It's a condition called ascites.
Okay, so the timeline, acute versus chronic, and the specific symptoms, they really give important clues, don't they?
They really do. Helps the vet narrow things down.
So thinking about where this nasty stuff actually comes from, what are the sources we should be aware of? Is it in the food itself?
Often, yes. The usual culprits are pretty common ingredients in pet foods.
Like what?
Things like cereal grains, corn is a big one, peanuts, other nuts, even potatoes sometimes.
Wow, so really common stuff.
Very common. But here's a key point. It's not always about bad ingredients from the start.
Oh.
Often, the contamination happens after the food is made, post-production.
How does that happen?
Usually issues with storage. If the food isn't stored correctly, if it gets damp or too warm.
Ah, okay, so mold grows in bag or container.
Precisely. Or, if a pet gets into obviously moldy food somewhere, or even eats contaminated garbage.
Right, that makes sense. And are there ideal conditions for this mold's growth?
Yes. These molds, the Aspergillus species that produce aflatoxin, they really thrive in specific conditions. Temperatures roughly between 24 to 35 degrees Celsius. That's about 75 to 95 Fahrenheit.
Okay, pretty warm.
And moisture levels in the food around 18 to 20%.
So if you think about maybe storing a big bag of kibble in a shed or a garage, especially in summer.
Exactly. In warmer, humid climates, those conditions could easily be met, which makes proper storage so critical.
Yeah. And you mentioned a concentration level earlier. How much does it take?
It's quite alarming, actually. In dogs, we've seen acute, serious signs show up when their food contains as little as 60 parts per billion.
60 parts per billion. That sounds incredibly tiny.
It is a really, really small amount, but it can have devastating consequences.
So how does such a minuscule amount cause such massive problems? What's it actually doing in the body?
It's quite a complex process. It's not like a direct poison in the simple sense. When a pet eats the aflatoxin, their liver tries to process it to detoxify it.
Okay, the liver doing its job.
Right. But in this case, the enzymes the liver uses specifically, a group called cytochrome P450 enzymes, they actually activate the aflatoxin.
Wait, they make it more toxic?
Paradoxically, yes. Think of it like the liver tries to disarm a bomb but accidentally sets the timer. This activated toxin then does a couple of bad things. It depletes a really important protective molecule in the cells called glutathione.
Glutathione, okay.
And then it starts binding to crucial parts of the cell machinery, like the DNA, the nucleic acids, proteins, even the little organelles inside the cell.
Wow, so it's attacking the cells at their core.
Pretty much, it disrupts normal function and causes damage, especially in the liver, which is where most of this activation happens. It's like this cascade of damage starting at the molecular level.
That's pretty scary. So when a pet comes in with these kinds of signs, the vomiting, jaundice, maybe the bleeding issues,
Yeah,
how does a vet figure out it's aflatoxin and not something else?
that's a great question, because several other illnesses can look quite similar. Vets call this making a differential diagnosis.
What else would be on that list?
Oh, things like certain infections, leptospirosis is one, parvovirus in younger dogs perhaps. Even poisoning from other things, like certain types of rat bait that cause clotting problems.
Rodenticides.
Yes, and of course, other types of liver disease that aren't caused by aflatoxin.
So lots of possibilities.
Exactly, which is why running specific tests is so crucial to pinpoint the actual cause and not just make an assumption. You need evidence.
Okay, so what are those specific tests? What will the blood work and maybe urine tests show if aflatoxin is the culprit?
There's often a fairly characteristic pattern of changes, though it can vary. In the blood work, vets often see lower levels of certain proteins that are involved in blood clotting, things like protein C and antithrombin the third.
Okay, the clotting factors.
Yes, and often cholesterol levels are down too. These are red flags because the liver makes these things, so low levels suggest the liver isn't working properly.
Makes sense.
Yeah.
What about things going up?
Right. At the same time, they'll likely see higher levels of bilirubin, that's the substance that causes the jaundice, the yellowing, and increases in various liver enzymes. You'll hear vets talk about ALT, GGT, AST, ALP.
A whole alphabet soup of enzymes.
Pretty much. But elevations in these specific enzymes indicate damage to the liver cells themselves. They might also find low levels of albumin, which is another key protein the liver produces.
So it's this specific pattern of ups and downs that points towards aflatoxin.
It can strongly suggest it, yes. Especially combined with the clinical signs, it helps differentiate it.
Are there other lab tests besides the basic blood panel that are helpful?
Yes, definitely. Looking at how quickly the blood actually clots is really important.
Measuring the clotting time.
Exactly. Tests called APTT, activated partial thromboplastin time, and PT, prothrombin time. Often, these times will be prolonged, meaning the blood takes longer than normal to clot.
Which fits with the bleeding risk you mentioned earlier.
Precisely. Now, ideally, you'd test the pet food itself for aflatoxin. That would be definitive.
But you said the food is often gone by then.
That's the practical challenge, yes. By the time the pet is sick enough to see a vet, the contaminated batch might be finished or thrown away.
So what else can be done diagnostically?
A liver biopsy can be very informative, though it's more invasive, obviously.
Taking a small piece of the liver.
Yes. A small sample is taken and examined under a microscope that's called histopathology. It can reveal characteristic changes in the liver tissue that are highly suggestive of aflatoxin damage.
And what kind of damage are we talking about? What does the liver actually look like pathologically?
Well, grossly, meaning just looking at it, the liver is often enlarged. It might look pale or yellowish due to fat accumulation in the jaundice.
Okay.
You might see that fluid, the ascites in the abdomen, and often small pinpoint hemorrhages, little bleeding spots, especially in the lining of the stomach and intestines.
And under the microscope,
Yeah.
the histopathology.
Under the microscope, you typically see fatty changes within the liver cells themselves, hepatic lipidosis. You'd likely see necrosis, which is cell death, particularly affecting the cells around the central veins within the liver lobules.
Cell death. Wow.
Yes. Also signs of bile flow being blocked up, that's cholestasis. And in cases that have been going on longer, maybe the chronic ones, you can even see fibrosis, which is scarring of the liver tissue, and something called bile duct hyperplasia, where the little bile ducts multiply.
It really paints a picture of, well, widespread damage to a vital organ.
It absolutely does. The liver takes a major hit.
This all sounds incredibly serious. So once a pet is diagnosed, what on earth can be done? Is there a specific cure, an antidote?
This is probably the most difficult part of the conversation, unfortunately. There is no specific antidote for aflatoxin poisoning.
No antidote. Wow.
No, so treatment really boils down to intensive supportive care, trying to help the body cope and heal while the toxin is hopefully cleared.
Supportive care. What does that involve?
It can involve quite a lot. Maybe giving blood transfusions or plasma transfusions, especially if there are clotting problems, to replace those factors and other blood components. Correcting dehydration and electrolyte imbalances with intravenous fluids is critical.
Fluids. Huh?
And if, and this is a big, if the exposure was known to be very recent, like within hours, and involved a large amount, activated charcoal might be given orally.
To try and bind the toxin in the gut.
Exactly, to try and prevent more from being absorbed, but often you're past that window.
Right. What about medications? You said no antidote, but are there any drugs used?
Some things are used to try and support the liver and perhaps mitigate some damage, but again, they aren't cures. One is a medication called parenteral N-acetylcysteine, or NAC.
Right.
It's sometimes given intravenously, particularly in very sick dogs.
Okay.
It has antioxidant properties and might help replenish glutathione, but it needs very specific dilution and dosing, strictly by a vet.
Right. Not something you do at home.
Absolutely not. Another supplement sometimes used is S-adenosylmethionine, usually called Xanomi.
Same. I've heard of that for liver support.
Yes. It's thought to help with liver cell function and protection. It's typically given as special enteric-coated tablets.
Why enteric-coated?
To protect it from stomach acid so it gets absorbed properly. And it usually needs to be given on an empty stomach for maybe 1 to 2 weeks, again with specific vet-prescribed dosages.
Okay. And a really crucial point.
A really crucial point is avoiding any other drugs that are metabolized or broken down by the liver.
Because the liver's already struggling.
Exactly. You don't want to put any extra strain on an already damaged organ. So medication choices become very limited and careful.
So assuming a pet gets through this initial, very critical phase with supportive care, what happens next? What does the follow-up involve?
Careful monitoring is absolutely essential afterwards.
Checking those blood tests again.
Yes, daily monitoring initially might be needed for those liver enzymes we talked about, ALT, AST, etc., plus cholesterol, and those blood clotting times, PT and APT. Monitoring protein C levels can also be part of it, basically tracking liver function closely to see if it's recovering.
Okay. And what about preventing this from ever happening again? What can pet owners do?
Prevention is really key, given how difficult treatment is. It comes down to food source and storage.
Avoiding moldy food seems obvious.
Absolutely paramount. Never feed anything that looks or smells moldy or off. Inspect the food. And proper storage is critical. Keep pet food dry kibble, especially in a cool, clean, dry place.
Not the hot garage or the damp basement.
Ideally not, no.
Yeah.
Airtight containers can help maintain freshness and dryness.
Good tip.
And simple hygiene, too. Regularly wash food bowls and any storage containers to prevent mold spores from building up.
So basic food safety, really. Treat it like you would your own food storage.
Exactly. The principles are similar, but the consequences of even microscopic contamination can be so severe for pets.
Now, even if a pet survives the acute poisoning, are there potential long-term effects to worry about?
Yes, unfortunately, there can be. Even with successful initial treatment, some pets may go on to develop chronic liver disease.
The damage can be lasting.
It can be. The initial injury to the liver might set the stage for ongoing problems down the road, even after the aflatoxin itself is long gone.
Okay, so putting it all together, what's the overall outlook, the prognosis for a pet diagnosed with this?
Honestly, the prognosis is generally considered guarded to poor.
Guarded to poor, that sounds grim.
It often is. Even with intensive medical care, it's a very serious condition.
Is there any glimmer of hope?
Well, there's perhaps a slightly better chance if treatment can be started extremely early. Like before the really obvious signs of illness fully develop.
But that's hard, right? Catching it that early.
Very difficult because the early signs might be subtle or nonspecific. So by the time it's clearly aflatoxicosis, significant damage may have already occurred. It really highlights the challenge.
Yeah. Okay, so the key takeaway here seems crystal clear. Aflatoxin contamination is a serious, potentially fatal threat to our pets. And it can be hiding, sort of unseen, in what looks like perfectly normal pet food.
That's the scary reality of it.
It just hammers home how incredibly important it is to be, really vigilant about how we store and handle our pets' food.
Vigilance is key.
And of course, if you ever notice any of those concerning signs we discussed, that sudden loss of appetite, the vomiting, diarrhea, especially Any yellowing of the skin or eyes is absolutely crucial. Contact your veterinarian immediately. Don't wait.
Absolutely. Early intervention is always best, even if the prognosis is tough.
Definitely.
And all this, it really raises a bigger question for you to think about, doesn't it? Considering how common things like cereal grains and nuts are as ingredients in so many pet foods, what other, seemingly harmless components might also have the potential to pose hidden risks to our beloved animal companions?